to masks within HISD schools, facilities, as you know, our school buses will all be optional with this modification. Anyone that may need additional layers of protection or are exhibiting symptoms of a communicable disease are highly encouraged to wear a mask regardless of their vaccination status. Anyone wanting to wear a mask can still request one when entering an HISD facility. The district will continue to monitor all COVID-19 data and trends and will be prepared to update its protocols in the event of community or localized COVID-19 outbreak, and recommends recommendations from health authorities as well will be definitely a means to gather additional insight. We know some of our families will agree with this decision, and others may have additional questions about this decision. Our families, students, and staff have shown incredible patience, resilience, and grace the past 2 years as we've navigated this pandemic. The virus is still circulating in our communities, but we have all the tools that we didn't have several months ago that are helping us through this particular point. But we have and will continue to monitor the data on a daily basis. HISD remains committed to providing safe in-person learning for our students and staff, the kind of work environment that allows us to ensure that learning happens on a daily basis. Some of the things that we will continue to recommend are, number one, free campus COVID-19 PCR testing for staff and students. Number two, COVID-19 vaccination clinics that will be hosted weekly on many HISD campuses. And lastly, additional testing and vaccination opportunities are available through our partners at the Houston Health Department and Harris County Public Health Department. In addition, all HISD facilities will continue to be cleaned and disinfected with hospital-grade products. So we thank you all for your partnership in ensuring that the message gets out there to our students, staff, and community. We ask that all continue to be safe. At this time, I'd be glad to take some questions before we head back up.
Superintendent, I was reading the Ready, Set, Go plan and saw some of the changes I imagine are exciting for students with field trips, no more assigned seating in cafeterias, buses. Is the expectation is going to be the last update before the end of the school year?
You know, we hope that we continue to climb in the right direction right now as we look at hospital usage, new case trends, cases per 100,000, positivity rates. As we continue to look at these items, we hope that we continue to see the trends that we're seeing right now. As you all may know, the positivity rate for last week decreased from 0.43% to 0.25%. If that kind of data continues at the rate that it's going, our hope is that we continue to provide the kind of normalcy with any additional changes that we might need to make to the Ready, Set, Go plan. So things are definitely heading in the right direction, and it's something that I think our students, like you said, will be excited about.
Was it simply like positivity rate that you guys were kind of monitoring, or was there kind of like guidance from the outside?
So it's both. I mentioned the COVID-19 ICU 14-day average for hospital usage is a data point. It's multiple data points. It's the new case trends. We know that new cases within the last 14 days have decreased by 63 cases per day. We also know that as we look at cases per 100,000 the weekly total for those cases for residents has decreased as well. The overall positivity rate, which is one of the mainstay data pieces that everybody sees and hears consistently, that 14-day average for COVID-19 in terms of the positivity rate is below 10%. We haven't been there in quite some time. We also know that the city has made some changes in reference to their masking of employees. We also know that the data level has allowed for us to move from the severe to the orange, which is significant. And the expectation is that data will continue to go in the right direction and will hopefully move into the yellow within the next 7 to 10 days if the trends continue at the rate that they're going. So it's multiple data points that we're looking at, not one singular data point. We also know that as we've learned about the pandemic over the course of time, different variants act different, quite frankly. The Delta variant was much different than the Omicron variant. Omicron moved faster. So you have to look at different data points along the way. And that's something that we've done on a weekly basis with our executive staff, is study these data points, and these trends continue to drive in the right direction. Alejandro?
Two-part question. One, before today, what are any litigation with the state with that massive lawsuit with multiple ISDs? And then the second part, what happens now? Is it dropped now that they're not technically violating?
So there hasn't been any insight in reference to multiple school district legal issues or whatnot. So we'll continue on the path that we're on right now, and we feel good about making the modification of the Ready, Set, Go plan that we're making.
So you was mentioning earlier some of the things like sightseeing and stuff like that. Outside of the mask, what are day-to-day activities that are now going to change and open up?
So we'll be looking at a few different things that we'll be modifying. Of course, HISD's relaxing the mask mandate, but we're also looking at field trips, travel, in-person gatherings. These items will be permitted following these guidelines that have been modified as well. Now, what we do want to remember is that we're very hopeful that we don't see a spike in the wrong direction or a different variant at some point. But if ever needed, if we ever needed to move forward with another mask mandate or reinstate, that possibility does exist. But to answer your question, yes, field trips, travel, in-person gatherings, those pieces will be modifications that you'll see in the Ready, Set, Go plan. We thank you guys for being here and appreciate your time. See you guys.